Hey everybody, it's Dr. Mark Sutor. Welcome to our Tuesday night session about overdentures. So first of all, my Hoosiers almost beat Michigan Saturday. We were that close. You know, when I was a freshman playing at IU, I was at Michigan and we had them tied into the fourth quarter just like that. And in about 6 seconds, Anthony Carter, who was a wide receiver in Michigan at the time, caught a 60-yard touchdown pass and beat us in the last play of the game. So my heart was out to those kids Saturday, and I know how hard it is to lose a game like that. So we're getting closer. So tonight we're going to talk about the hazard of being edentulous, meaning not having teeth, right? So a lot of people kind of make the mistake that when they make their decision about, you know, I'm kind of tired of my teeth, I think I'm just going to have them taken out. You really kind of trade one problem for another. So you may have cavities or gum disease with your natural teeth, but then as soon as you have all your teeth taken out, the thing you swap out for is a lifelong kind of struggle with bone loss. And we'll talk about that. So what we're going to talk about today is the difference between a conventional denture, which is what some people would wear. So conventional denture is when people have no teeth, and they usually put kind of an adhesive or something on the top in their palate, and they put it in their mouth, and usually the adhesive or the suction that's formed helps the denture stay in the patient's mouth. Probably the biggest complaint people have about dentures like that is that food doesn't taste very good, because when you have your palate covered like that, you lose all that sensation of texture and taste sensations with food. And the other problem is that people talk about not being able to eat really well. So when say you have natural lower teeth and an upper denture, when you chew, that upper denture has a tendency of moving, and you really don't chew food very well. So the problem with dentures that are always unstable is the ability to tear food. Because think about our teeth like food processors. You put food in there, you pre-process your food, so when you eat it, you don't have to produce as much stomach acid to digest your food. When you have dentures, you typically chew up food and you kind of mash it, and then you eat what's called a bolus of food, meaning you just kind of swallow big chunks of food that get down into your belly. And when people have GI problems when they have dentures, it's because they're not pre-processing their food. So one of the biggest advantages to having teeth that are more stable is to be able to pre-process your food. So when you eat, let's say that you have dentures that are supported by implants, now when you eat, your teeth are not moving and you're able to process food like you would with your natural dentition. So I tell people all the time, when they think about the decision of having a denture or thinking about how implants can support their teeth, the second biggest problem is your bone continues to deteriorate. So how many of you out there have either know somebody that has a denture or has a denture themselves? You'll notice every few years you kind of feel like your denture gets loose and it doesn't fit as well. The first comment people will make is, oh, my gums are shrinking and I need to get my denture refitted because my gums are shrinking. The problem is your gums aren't shrinking, your bone's shrinking. So what's happening is the bone underneath your gum is melting away, and the gum is just following the natural deterioration of your bone. So when your gum shrinks underneath your denture, it's because your bone has deteriorated and your gum is just following the pattern of the bone loss. So the really sad thing about that is if someone goes for years without teeth, your upper and lower skull, your physical jaw structure decays. So if you ever see people that take their dentures out and their whole face kind of collapses, it's because you no longer have that bone structure that you had when you had teeth. So therein lies the importance of implants. So some people call dental implants bone stabilizers or denture stabilizers. So the key about an implant is, if you put an implant in your jaw, you literally will have that implant support that area of your jaw as long as that implant is healthy. So when you take a tooth out, one of the things people don't remember or don't really understand is when you take one tooth out, the research would tell us that within about 6 months, you lose anywhere from 40 to 60% of your actual jaw bones. Let's say you have one of your teeth taken out and you looked at your bones 6 months later, you'll have about half of the jaw structure that you had there when you had a tooth there. So if you have implants put in your jaw, let's just talk about an upper denture, because people ask all the time, how many implants should I have to support my upper denture? And the answer is you always need to have at least 4. So think about putting these implants in where your molars used to be and where your canine teeth used to be. I tell patients all the time, It's kind of like building a support of a horseshoe, right? A lot of people that shoe horses will say you need to have so many supports to support that arch so that it's stable. I tell people all the time as well, it's kind of like building a four-legged table. So if you have 4 legs on the table is going to be pretty sturdy. You can get away with 3 legs and tripod it, but you can't do that really well with your upper jaw because your upper jaw is not as dense, your bone is softer. So when you just put 3 implants in your upper jaw, the denture isn't supportive as well. So if someone tells you they can do an upper denture, excuse me, with implants and put 2 implants in or 3 implants in, they're not really reading the literature very well because most of the literature would dictate that you should have about 4 implants. So here's what you want to think about. These implants will be like man-made roots, right? So if this in this clear model, excuse me, that this implant would simulate the root of your tooth. So once you spread them out properly, all your dentist has to do is put these little rings on there called abutments. Now those abutments line up with with the inside of your dentures. So we call it kind of a male-female attachment. You have the little female ring inside your denture and then male attachments inside your mouth. So when those 2 things line up, you'll hear that audible click of your teeth. I'll do that again. You'll hear this. And what that's really doing is it's snapping in to those implant abutments. And now when you go to remove that, it's much tighter and it fits more like teeth. So the luxury is if you put enough force on there, you'll be able to remove them yourself. And your oral hygiene is mainly brushing these little abutments and keeping your denture clean. So if you think about the advantage of this kind of scenario over the course of your life, after you lose your teeth, these implants will allow you to eat better. You'll be more confident because your teeth won't move around. Some people get really anxious because they feel like their teeth aren't stable. And if you're talking in public or you're in a situation where you're insecure about the stability of your teeth, you really don't have to worry about that. And then the most important thing about having implants in your jaw like that is your bone quits shrinking. So one of the biggest things people really don't understand is when you lose your teeth, people don't realize you lose your bone as well. So I think one of the best scenarios of having implants is not losing your bone. Excuse me, oh, cough. So on your lower jaw, what you can do in your lower, because your bone is denser in the lower, you could put a couple of implants in your lower jaw. Ideally, they should be spread out more. They should be more like over here. This is just a representation. But in your lower jaw, you can then snap that in, and now you put 2 implants in your lower because your bone is denser, and you can support that. But I always tell patients, if you have 2 implants like this, the denture will still have a tendency, if you bite towards the front, it may still have a tendency of rocking like that because there's not supports in the back. So if you can ever afford to have implants placed just like your upper, where you actually have 4 implants in that position, here, 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 and here, then now you have the same scenario you had on the upper. When you put that in place, now that your teeth really don't move because now there's 4 points of stability holding that in your mouth, as well as preventing your bone from deteriorating there. So when people ask about implants, I would tell you in the Midwest, the average cost of an implant is about $2,000. So if you think about if you did lower implants with lower dentures with a couple of implants, you could spend $4,500 maybe in your surgery and a couple of $1,000s in having your denture made. If you had more implants, you can do the math on that. Usually the dentures don't vary too much. If you have 2 implants or 4 implants, the cost of your denture is probably going to be pretty similar, probably a couple of grand, maybe $2,500, something like that. And then the number of implants is kind of what your surgical cost would be. So anyway, I wanted to introduce you to the idea. I know we've talked about a little bit about it before, but I wanted you to understand the difference between a conventional denture and an implant-supported denture, and the fact that what an implant can do for you in the support of your jaw and in the support of your teeth. So if you know anybody that has dentures or struggles with their denture, especially when they complain about having like soreness, they eat something or they can't eat food anymore, that type of condition, that type of treatment could be really good for them. We'll talk about the concept of mini implants later at another discussion. People ask me about that all the time, and I'll tell you about the pros and cons of what are called mini implants, which is an option if your bone is really thin. So I hope this helped. If you know anyone that is struggling with their denture, let them know there is an option and there is a way out and there's a way to have a better life. So I hope you enjoyed it, and I will see you next week, and let's hope the Hoosiers can beat Michigan State on Saturday.